Welcome to our comprehensive guide on patient assessment, an essential skill for every healthcare professional. In this video, we'll walk you through the process of accurately defining a patient's problem using both subjective and objective methods. A thorough assessment forms the backbone of any effective treatment plan. Without it, developing an appropriate approach to care becomes nearly impossible. We'll cover everything from gathering personal details and medical history to performing physical examinations and interpreting key investigations. Let's begin by understanding why assessment is so crucial in clinical practice and how it sets the stage for patient-centered care. The first step in any assessment is collecting the patient's personal details. This includes their name, date of birth, address, phone number, emergency contact, and occupation. Next, we move to the chief complaints, the main reasons the patient seeks medical attention. Detailed history follows, covering the presenting condition, previous medical and surgical history, current medications, drug allergies, family history of major diseases, and social factors like household duties, home layout, hobbies, and habits such as smoking or alcohol use. These details provide context and help tailor the assessment to the individual's unique circumstances. Objective assessment involves listening to the patient's own account of their symptoms. Open-ended questions are key here, allowing patients to describe their experiences in their own words. For respiratory diseases, focus on 5 main symptoms: breathlessness, cough, sputum or hemoptysis, wheeze, and chest pain. For each symptom, ask about duration, severity, pattern, and associated factors. This approach helps uncover the nuances of the patient's condition and guides further examination. Remember, understanding the patient's perspective is vital for building trust and ensuring accurate diagnosis. Breathlessness or dyspnea is a common symptom in both cardiac and respiratory diseases. Assess its duration and severity by asking about the patient's activity levels. Tools like the New York Heart Association, NYHA, classification, and the Borg rating of perceived exertion scale can help quantify breathlessness. Cough is another important symptom. Determine if it's productive or dry, and note any patterns, such as nocturnal cough or coughing after eating. Understanding these details can point towards specific diagnoses, such as asthma, bronchitis, or aspiration. Sputum analysis provides valuable clues about underlying conditions. Note the color, consistency, and presence of blood or black specks, which can indicate infections, pulmonary edema, or smoke inhalation. Grading sputum helps track disease progression. Wheeze, a musical sound from narrowed airways, and stridor, an upper airway sound, are important to recognize. Chest pain requires careful evaluation. Pleuritic pain, tracheitis, musculoskeletal pain, and angina each have distinct characteristics. Understanding these differences is crucial for accurate diagnosis and timely intervention. Objective assessment involves a thorough physical examination. Start with general observations: alertness, ventilation, body temperature, heart rate, blood pressure, and respiratory rate. Look for signs like tremors, muscle wasting, or clubbing of the fingers, which can indicate chronic disease. Examine the hands, eyes, and skin for clues such as cyanosis or jaundice. Assess jugular venous pressure for heart failure, and observe the chest for shape, movement, and breathing patterns. These findings, combined with the patient's history, help form a complete clinical picture. Detailed chest examination includes inspection, palpation, percussion, and auscultation. Inspect for chest deformities like kyphosis or pectus excavatum and observe breathing patterns. Palpate the trachea for deviation and assess chest expansion. Percussion helps identify areas of dullness or hyperresonance, pointing to consolidation or pneumothorax. Auscultation is vital. Listen for normal and abnormal breath sounds, adventitious sounds like crackles or wheezes, and heart sounds. Each technique provides unique information, contributing to a holistic understanding of the patient's respiratory and cardiac status. After the physical exam, investigations help confirm or clarify the diagnosis. Pulmonary function tests measure lung volumes and capacities, distinguishing between obstructive and restrictive disorders. Arterial blood gases assess acid-base status and oxygenation, while chest X-rays provide visual evidence of structural changes or pathology. Each test has specific indications and contraindications, so choose wisely based on the clinical scenario. Accurate interpretation of these results is essential for guiding treatment and monitoring progress. After gathering all information, summarize the patient's issues in a concise problem list, prioritizing the most urgent concerns. Develop initial plans using the SMART framework: specific, measurable, achievable, realistic, and timed. Set both long-term and short-term goals, focusing on restoring the patient's maximum functional capacity. Finally, outline a treatment plan detailing specific interventions, frequency, and equipment needs. This structured approach ensures that care is tailored, measurable, and patient-centered, leading to better outcomes and continuous improvement in clinical practice.